and welcome back to another insightful episode of MedSynapse podcast. I'm Hitvisha, your host, and today we have an exciting episode lined up for you as we delve into the fascinating world of musculoskeletal ultrasound and its impact on patient outcomes in inflammatory arthritis. Early and accurate diagnosis is crucial for effective management and improved patient outcomes. And musculoskeletal ultrasound has emerged as a valuable tool in detecting and monitoring these conditions, offering a real-time insights that can significantly improve uh, treatment decisions. And joining us today to discuss this topic is Dr. Pradeep Das, a distinguished rheumatologist with a profound interest in inflammatory arthritis. Dr. Das is highly experienced in musculoskeletal ultrasound, guided procedures, and pain management, and that's what makes him the distinguished guest today for this topic. Dr. Das serves as the Chief Coordinator and Trainer for Clinical Audit Program at his current hospital in Malaysia, and is the Head of Rheumatology Unit at the Hospital Seri Manjung, with over 16 years of experience, more than 10 publications, and membership in the Malaysian Society of Rheumatology. Dr. Das brings a wealth of knowledge and expertise to our discussion today. So, welcome Dr. Pradeep to our podcast today.
Hi, MedSynapse. Thanks for having me. It's a pleasure to be here with you all.
So, to start with, can you share with us how recent advancement in MSK have improved the detection and management of inflammatory arthritis?
Okay, yeah, sure. Okay, before I go through that, I think it's only fair if I share some base or background history about ultrasound in rheumatology. Now, ultrasound in rheumatology actually started in 1958. Actually, it's not really rheumatology per se. In 1958, ultrasound was introduced in the medical profession. And about 20 years later, it gathered some support and was introduced in the rheumatology fraternity. So it's a very fascinating piece of technology. It brings a lot of benefit in how we approach our patients. And in 1981, that was the first time where clinical synovitis, meaning joint pain, joint inflammation, was detected via ultrasound. So extremely fascinating. And in 1994, that's when technology became much more advanced, and something called the power Doppler signals were detected via ultrasound. So how does this all bring in together in terms of ultrasound affecting our treatment modality and investigative modality? So with the advent of ultrasound in the rheumatology fraternity, things have changed throughout the years. It first started as a huge machine. It may fill half a room. Then it was shrinked to the size of a CT machine and an MRI machine. And now high-end machines roughly are the size of an echocardiography machine. So it's fairly small, it's portable, it's movable between rooms, clinics, and so forth. In fact, we also have laptop-based ultrasound devices. And in the past 3 to 4 years, you actually have handheld Bluetooth devices. So how does this help us? So basically, I would say probably 70 to 80% of rheumatologists' work is based in the outpatient department. So when we see patients, right, after taking a detailed history, examining them, if you have an ultrasound device in your clinic itself or in your outpatient setting, you can immediately scan these patients. And having that facility there enables you to look into the joints of these patients, and based on the patterns and the Doppler signals that are seen there, we can easily come to a diagnosis. So basically, it speeds up the entire process. So it is a crucial medical device that helps us in modern day rheumatology.
That is very fascinating. Now, considering the early diagnosis aspect, how effective is MSK ultrasound in the early diagnosis of inflammatory arthritis compared to traditional imaging methods like X-rays or MRI? I think this is the most asked question.
Okay, very nice question. Now, when we talk about classical imaging, right, if you ask any doctor, what would come across their mind is basically X-rays. That would be the first thing. Why X-rays is widely available? Nearly any hospital will have it, even basic clinics will have it. Rural clinics themselves have X-ray facilities, right? So the beauty about X-ray facilities is cheap, it's fast, but it does have its problems as well. Whatever said and done, although the radiation risk is low, when you do multiple X-rays for a patient with inflammatory arthritis. So inflammatory arthritis is quite fascinating on its own. It involves multiple joints. So at the same time, you would order X-rays for all these joints. And with the cumulative effect of all these joint X-rays, the radiation dose isn't as small as many people think. Another thing is, in classical imaging, such as X-ray, you have to position the patient in a fixed position for the radiologist or the doctor to appreciate the changes that are seen in the joints, right? But having said so, these patients come with pain and swelling. They may find difficulty putting their joint in that particular patient, that particular position. And sometimes your images are not as good as you want them to be. Now, if I were to look at a patient and do an ultrasound, a musculoskeletal ultrasound, one thing, it's also very fast. It's also widely available. Cost-wise is of course not as cheap as an X-ray, but again, not as expensive as MRI or a CT or something like that. It is super safe. There is basically no side effects that comes with it. And aside of diagnosing, it's also has its charm in the sense that you can use it for a therapeutic indication, which probably I'll talk about it a bit later. So if you compare to the other imaging modality that's available, such as an MRI, right? So MRIs are only there in major centers, tertiary centers. I think if you take across the world, if you look at the Western Front as well, it's not like you're going to find an MRI in a rural district hospital. So these patients have to travel quite a distance to even get this facility. And if you want to organize an MRI, right, the slots are limited. It's not something that is available so easily compared to an X-ray or compared to a ultrasound. So it's hard to get an appointment, and it's also very costly. It's very time consuming. For you to scan a small segment takes like 20 minutes to 30 minutes. And here we are talking about scanning multiple joints. So it's a very uncomfortable thing for a patient to go through. On the other hand, an ultrasound, I could literally scan any joint, put the patient in a comfortable position, adjust my probe accordingly to the patient, and it's non-inferior to an MRI. And the best part, if I was to compare it to an X-ray, it is 7 times more sensitive than an X-ray. I could basically do an X-ray of a joint, and if I do an X-ray of a joint, it could look pristine, it could look crystal clear, it looked completely normal. But a same patient, when I put my probe on the joint, you could actually see erosions, small tiny holes in the bone. So I think that makes a big and a key difference between looking at a patient with an ultrasound versus classical imaging.
It's incredible how such a probe can make such a big difference. Now,
Yes.
Now coming to the next question, could you elaborate on how the use of MSK ultrasound influences the treatment decision in inflammatory arthritis?
Yeah, okay. So classically, if a patient comes to the rheumatology outpatient clinic, right, what happens is, if it's a first visit, what happens is the doctor, the rheumatologist, will sit with the patient, and as usual, we take a very long, detailed history, and then we examine the patient. And it all depends, because what happens is usually after seeing the patient and sort of suspecting what they have, we order the appropriate blood tests. The problem is with these blood tests, they are not available immediately. Some of these tests take 2 to 3 weeks, and in some centers, it may take even longer, up to 4 weeks. So you can't actually institute treatment because your diagnosis is not confirmed yet. Now, if you have an ultrasound device, as for example, rheumatoid arthritis. So when we scan the patient, for example, if we were to scan the knee joint, right? By just placing the probe at the appropriate point on the patient, you get to view the knee joint, you get to pick up whether there's fluid inside. And I was mentioning earlier about power Doppler signals. So if you get this particular finding in the ultrasound, it kind of tells you that the disease is active. And different diseases obviously have different kind of signs which we pick up. And based on these signs, we can come to a relative confident presumptive diagnosis. And upon discussion with the patient, we could actually start treatment way earlier. Of course, we still do the blood test, but it goes hand in hand, and definitely everything is brought forward way earlier.
Wow, that is very insightful. So I think this ultrasound is more beneficial and it should be used more than the traditional ones, right? Yeah.
Definitely, yes. Yeah.
So now, in what ways does the use of MSK ultrasound help in reducing delays in diagnosis and initiation of appropriate treatments for inflammatory arthritis?
Okay, I'll give you a couple of examples, probably it'll be easier to appreciate. For example, if I have a patient that has, let's just say, has been suspected to have some form of inflammatory arthritis, and it's the first time I'm seeing this patient, as usual, we take a history, we examine the patient and say, I put the probe onto this patient. So based on the ultrasound itself, most often what we do see in the patient is fluid in the joints, or what we call synovitis. But there are many causes of synovitis. It could be infection, it could be some other chronic conditions such as gout. So what we do is, if we see significant fluid, we can actually introduce a needle, ultrasound guided, aspirate that fluid. So in one sense, this helps the patient because when you reduce the amount of fluid, the joint becomes less tense, it becomes less painful for them, and they gain the mobility of the joint. At the same time, once we aspirate the fluid, we can look under the microscope. And based on the microscopic finding, we can say this person has gout or pseudo gout, or probably an infection. So it rules out quite a number of conditions. Likewise, while we aspirate and remove fluids, we can introduce medications inside. So if you're confident that it's inflammatory arthritis, and what we could do is introduce a small dose of intra-articular steroids. And the beauty about this is, when you introduce steroids in this manner, it brings down the inflammation so fast, they get, I would say, near instant relief. Yes, and the side effects of steroids, it's not something you're taking orally. So the systemic side effects of steroids can be spared. So it's a relatively well-targeted treatment. Another thing is, a patient could come to the clinic and tell you that I'm so well now, I don't have any joint pains. Partly maybe they've already taken some medications and that has masked their symptoms. So, and in the same way, we can just put the probe, show them what's going on in the joints, whether there's fluids or there's something called synovial hypertrophy, and that actually helps patients accept what's going on. And that actually helps with treatment adherence and their future follow-ups, because we can follow them up by doing serial scans to show them, okay, I started this medication and this was how it was before, and look at you look at it now and see how you feel. And it really helps. It really helps because it's an objective thing which they can perceive and they can appreciate for themselves.
Yes, right. And does it even help in early intervention, early diagnosis of the disease?
Yeah, definitely. So if you were to see a patient early, and for example, some of the early investigations were not done by the referring doctor. So when we clinically assess the patient and we suspect, so certain joints are kind of more prevalent and the disease is more prevalent in these joints. So when we scan them, we can find findings in those particular joints. If I was to do an X-ray for a person with early rheumatoid arthritis, it might be completely normal. And you would be like, okay, sounds like this patient has arthritis features, but without specific blood tests, I can't confidently say that this patient has rheumatoid arthritis. But by ultrasound, and if I do pick up those classical findings, yeah, I can safely say, yeah, you do have rheumatoid arthritis, and I think we need to discuss further on the appropriate treatment and suitable treatment for you. So it does definitely shorten the diagnosis period, and by shortening the diagnosis period, it brings so much more advantages to the patient.
Yes, right, definitely. Now, coming to the next question, how can MSK ultrasound be effectively integrated into routine rheumatology practice to enhance patient outcomes in inflammatory arthritis?
Yeah, okay. So I think this is something that all modern rheumatologists are gearing towards. All of us who have been exposed to MSK ultrasound find it extremely beneficial. In fact, most of us go around telling people that the ultrasound, the musculoskeletal ultrasound, is a complete replacement of the traditional stethoscope for us. It's so good and so helpful. So I think in inculcating it into our daily practice actually starts from the point a physician is trained as a rheumatologist. I think worldwide, if you take India, America, even the European countries and Southeast Asia, all of us have our own societies, local bodies, and all these local bodies, I think if you look at it across the board, are very gearing towards musculoskeletal ultrasound. So if you look at the Americans, they have the American College of Rheumatology. Over the past 10 years, they've been pushing this forward. If you look in Europe, we have the European League of Rheumatology, and they themselves have also introduced certification training programs to increase the uptake of MSK ultrasound. In my country, Malaysia, we have what is known as the MSR TUI. So TUI stands for the Targeted Ultrasound Initiative. So what we do is we train the younger generation or the upcoming rheumatologists to be confident in the usage of musculoskeletal ultrasound. And I think it's a very good uptake, not only here, but I think across the world on the whole.
Yes, thank you for sharing that, and that is like a strong and good initiative.
Yes.
So
yeah.
now, before we wrap up, I'd like to ask one question from my end. What inspired you to pursue a career in rheumatology and focus on musculoskeletal ultrasound? And what do you enjoy the most about your work?
All right. So I think I owe this a lot to one of my previous consultants. He was a rheumatologist, and he was a very gentle man. So what I would see is there are so many of these patients. You see, rheumatology is a very rare disease. A lot of doctors, even specialists, may miss the initial diagnosis, and these patients end up suffering. They have a lot of pain, and often the last resort is to refer to a rheumatologist. So when I saw this consultant of mine treating patients, they would come in crying, literally in so much pain, and just by talking to them, examining them, reassuring them, he brings down their stress levels so much, they actually walk out from his room comfortably. In terms of personal experience, I feel rheumatology is something where if you are able to diagnose the patient early, they may come to you in a wheelchair, but if you treat them appropriately, it's within a couple, maybe a month, they are easily able to walk into your clinic. So I believe I make a difference, and so does all of us in the rheumatology fraternity, and that's what I think drives most of us.
Yes, it does. You do make a huge difference, and thank you for sharing that.
My pleasure.
It's been an enlightening discussion on this topic, and it is a pleasure to learn more about your professional journey as well. And I look forward for more such discussions with you. Thank you for giving your time to us.
Okay, glad to be here. Thank you so much for the opportunity as well. I hope the discussion was truthful and beneficial to your listeners.
It was, it definitely was as beneficial. I hope it is as beneficial to me as to our listeners as well. And thank you to our listeners for tuning. We hope you found this episode informative. And remember, if you are a healthcare professional who is eager to delve deeper into medical topics or have questions, don't hesitate to join us on MedSynapse platform. MedSynapse platform is not just a resource. It's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay healthy and take care.